So, ladies and gentlemen, we always had a topic called Legends in Nephrology. And we have already presented 15 legends in the last 15 meetings. And today is the 16th meeting. And today we have the death anniversary, 9th death anniversary of late Professor Ramdas Pisharody on 29th. So we thought it may be very appropriate to remember Ramdas Pisharody on this day and as a second part of our session. So legends whose contribution inspire us even today. So and today I am very happy to introduce Professor Ramdas Pisharody as a legend. Professor Ramdas Pisharody was more associated with Trivandrum Medical College. He was the principal from 2008 to 2015 of Medical College Trivandrum. He then joined SUT and KIMS, and he had rather a premature death at the age of 62, 9 years back exactly. And remembering him on his 9th death anniversary, he's a very dedicated clinician, inspiring teacher, and compassionate human being. Though years have passed, his legacy continues to guide and inspire us. Basically, he was trained under Professor Kripal Singh Chugh at PGI Chandigarh, the premier institute at that time and even today. And this is the popular DP photo of Professor Chugh with his students. At that time, I think it was made in 1980 or 85 or so when we all finished our studies. Professor Chugh's blue-eyed boy was Ramdas Pisharody at our time, very intelligent, and you can see that Ramdas is here. And I have been very lucky to be his classmate or batchmate with Ravi Raju on his left side of Ramdas Pisharody. You can see Professor Saguja in the inner circle, and then so many people are there. I can see Kashi Vishweshwaran, sometime here, very young fellow at that time, 1984, 82, that time he finished. So we all admired and got inspired by Professor Chugh, and Ramdas was a very, very studious and very pet student of Professor Chugh. Coming back to his basic education, he graduated with flying colors from Trivandrum Medical College, did his MD and DM, I told you, in PGI. Then he got his master's in Canada, FSCP by the Royal College of Physicians. It was bestowed on him. And to me, what I thought he has contributed a lot to the nephrology in Kerala in particular. But the most important thing to me was that he has set up an excellent nephrology department at Trivandrum, though he worked in Kottayam and Calicut for some time. But he said, good DM examiner, and many of the DM examiners like Gopalakrishnan N and Edwin has got very good memories about him when I talked to them about it. I'm very happy to note that he has trained directly and indirectly in 2 medical colleges, 21 DM nephros who are now HODs and senior people like Satish Balan are here. And the 2 other things which Professor Ramdas Pisharody did was he initiated the deceased donor program, cadaver kidney transplant program under the Mruda Sanjeevani or Kerala network of organ sharing. Also, he contributed at the time when he was principal multi-super specialty block at Medical College Trivandrum. Then thereafter he left Medical College and worked at KIMS and SUT Hospital. So, ladies and gentlemen, I'm very happy to remember Professor Ramdas Pisharody as my classmate and a very passionate, very enthusiastic, very nice fellow. We had spent 2 years in PGI, and he was very helpful in our learning because of sharing from colleagues was another one way of learning. And to Jayasree and the children, I want to say Ramdas is remembered forever. He'll be remembered deeply. Thank you. May I request Satish Balan, who had good association with Ramdas to say a few words. Sadish, please.
Thank you, sir, for the remarks and for giving me the opportunity to speak on Dr. Ramdas here. So when you speak about legends, it is important that our generation, our previous generation, all of them know Dr. Ramdas very well. Our generation, most of us know Dr. Ramdas very well, but the juniors who are here may not have seen him, and many of them may not even have heard of him. So it is important that you know who is Dr. Ramdas, what he stood for, and everything. First of all, let me speak. Dr. Ramdas Pisharody, to me, was one of the greatest clinicians as well as teachers that I ever seen in my life. That I can say without any regard. I have seen a lot of people, but not to a person of that level. The way he could interact with patients, the way he treated patients, and the way patients looked up to him as a doctor, that is something that we should all learn from him. Because none of the patients, the patient-doctor relationship was at another level. You cannot think of any of his patients trying to think of filing a case against you or something. So much was the interaction rapport with him. And he would go to any extent in order to treat the patient. Suppose the patient was short of money, he would even find sponsors. He would get drugs on a free basis from companies and give it to them, and he would ensure that they were able to qualify for the best type of treatment they did. So his attendance to patient was remarkable, and his clinical sense was just awesome. One day, I remember in the wards, he said, just told one of his patients, said, "This lady you take for dialysis immediately." I had examined all the patients in the morning. I did not think that lady particularly required dialysis. But what happened, I immediately informed the dialysis unit, and unfortunately, there was a delay there. And what happened, the patient had a cardiac arrest before he could take for dialysis. So in those days, we didn't have mobile phones, so none of this could be a thing. So I realized that sir had found something there, which we could not find out. I asked, but I do not know what exactly he could find in that patient, which I could not see later. But that was the extent of clinical sense. He would just see the patient, examine. There's another lady who I know who had a biopsy which showed MPGN. So we were just saying MPGN. In those days, MPGN was just MPGN. You had that classification based on light microscope immunofluorescence, that's all. And then the patient was admitted for some reason. And then he saw the patient and said, have you done a kappa lambda staining in the biopsy? And then that report was not there. So he called Dr. Ramamani at Apollo, who was doing all the biopsy staining that time. And he asked her to do it and found out that she had only kappa staining. There was no lambda staining. She had done that, but she had not reported that for some reason, or it was not there in the report. And then we evaluated and she had myeloma. So it was a 40-year-old lady. I would not have expected myeloma in a 40-year-old lady, but sir was ahead of his time. He could sense the MGRS in her, even though MGRS had not been described at that time. So that was the type of person that he was. As far as and teaching, he was a brilliant teacher. He would not only clinical teaching, but also didactic teaching, taking lectures. His lectures were so beautiful and so easy to understand and so interesting. He would make them with a lot of humor and other things in the lectures so that you would listen to it properly. And then clinical teaching, of course, in the wards, he would pick up the clinical science, which none of us had done. He would find out what investigation you would do. He will find out what you have missed in that patient and what you should do. So all those things that he could do. Unfortunately, none of us are as good as him in order to repeat the same thing. That's the unfortunate part of it. But hopefully, at least we have learned something from him, which others cannot learn. So that is what I would say. And lastly, about case discussions and all that, even that is the way he would approach the case and the way he would take it to the diagnosis was truly remarkable. So he was, and not only that, he was also involved in multiple activities, like Dr. Georgie Nayan said. He was a brilliant administrator, and he made Trivandrum Medical College enter the next stage. After long years of neglect, it was finally a new super specialty block, and everything was created by him, and it was a remarkable achievement that he had. So not only as a teacher, as a professor, as a administrator, he was excellent. And as a human being, I can say that he was probably the best person, the best friend that you could have. Even when we were PGs and he was take us, he would make sure that we were well looked after, and he would ensure that we did not suffer from any problems. And he would also introduce us to all the senior faculty. So I got to know a lot of people through him. So that was how I managed to make some contacts and networks in those days. Yes, so I don't know. There are more and more which I can say, but I have to close at some time. Yes. So thank you, sir, for that opportunity.
Yeah, thank you very much, Dr. Sadish, for the personal interactions you had with Professor Ramdas. May I request Professor Noble Gracious? He continued the journey with deceased organ transplantation Kerala. Now K. Soto. Professor Noble, please.
Thank you, sir, for giving me the privilege to share my experience with Professor Ramdas. I had only around 8 to 9 years of experience with sir as a student and as well as working along with him as an administrator. As a student, whatever Dr. Satish has echoed is almost 100% true with me also. And the word epidemiology in chronic kidney disease was introduced to me by sir, and I that taken my to set up a registry in Trivandrum, because whenever we tell something in the ward about anemia in CKD or CKD MBD, he immediately asks what is the USRD's data on CKD SRD or anemia in ESRD. And next time when we talk about USRDs, he'll say what is Australia New Zealand registry talking about that. That is the sharpness he had when talking about the data, because I know that he has already trained in McMaster in epidemiology. So whenever we talk about vague things, he'll come out with numbers quantitatively and incite us to read more. And as also in the classes, the important is if a topic is given to us to present, if we study very well and come with anemia and CKD, he'll start about talking about erythropoiesis, how the bone marrow respond to drugs, and we never expect that this type of minute details we should know. So this is how he incite us to read more and always deviate from even the case presentation. We read about the case and go and sit in front of him. He deviate, then goes to nutrition, enhance survey. Yeah, that is how we move away and told us the world of nephrology, which what we have not read or we have not come across in the textbook. That is my experience as a teacher, and also what Dr. Satish was telling in the ward rounds and all. The intuition is so great because he can identify the danger is happening in the ward. If there even we have actually ward floor patients during that time, so he don't come and see all the patients. He just pick up 3 or 4 patients or 5 patients, and we'll ask us in acute rounds. He'll ask which patient you would like to show me. So and we suddenly tell us, Sadiq are telling, take for dialysis or this investigation should be sent. So probably that will be the correct diagnosis also. So this and from disease donor experience in 2012, when my resident went into the neurosurgery ward and said there is a one potential brain dead patient, and we have not started disease donor program. It's in amidst it, I think around 11:30 in the night. I called sir, we had a brain dead patient. We don't have any list. Or he said, you just give me 5 minutes, I'll come back to you. He called health minister, he called secretary health, he called DME, he called everyone and come out with solution. And we made the first disease donation. And we didn't know how the organ should be packed. He said, you just pack in ringer lactate and do it because it will work. And it worked, and that gave life to 2 young boys. Is still alive. So that is how disease donor program started. And no decision, every decision was taken so quickly, and he had a very good clout in the administration. So all decisions, even 2012 order on disease donation still holds good, and that was the visionary he had. And as administration, SSB block, multi-specialty block, all came in his tenure. And I had a good privilege of entering in principal's room at any time. Many of the HODs coming and waiting to see him. Waiting. I'm having a free access to sir's room. This is my, and one more thing I want to personally share. When I think during my exam days, I was studying at home. He sent one personal assistant to my room, my home, with a cover at the envelope. And it had around 20-30 questions, important questions. And I think most of them came to me as essays. I don't know whether Sixar has said the question, but this is what happened. And during my practicals, every 30 minutes or 1 hour, he used to call the examiner and ask, how is it you doing? That is the care he take care of his students. That is all, sir. I actually tried to pursue some of his ideas, like doing some epidemiological work, imparting research in my postgraduate students.
Thank
teaching
you.
them clinical points. Some work I imbibe from him. I am trying to pass it on. Thank you, sir. Thank you for the opportunity to
Thank
share
you,
my experiences, sir.
Professor Noble Gracious, very much for sharing your personal views about Ramdas Pisharody. Now we'll move on to Professor Reviraju. Yeah, Reviraju is known to all of us, past ISN President, ex-VC from Vizag. More than that, he was Ramdas's classmate. Three of us were in one batch. And Professor Reviraju, please.
Thank you very much, Georgie. Thank you very much for giving me this opportunity to fondly remember Ramdas Pisharody, a cherished friend of mine, as well as yours, of course, on this extracorporeal nephrology group. See, my association with Ramdas dates back to nearly 44 years. So if you go down the memory lane, there are so many things I can tell about, and we can keep on telling on and on, but an endless thing. It's difficult to believe that 9 years have passed after Ramdas has left us very prematurely at the age of 62. Beyond one thing I will tell you is, beyond his professional excellence, which has been mentioned by Satish Balan and several others, it is his warmth, his friendship, and his integrity and the character that remain deeply etched on our hearts. That is the most important thing. You might have felt his warmth, Georgie, for nearly 2 years. We were very closely associated, all three of us. And 9 years have, it's difficult to believe that 9 years have passed after Ramdas has left us. It is true that after 2 years of our association, we parted our ways. Though we parted our ways, we never disconnected. We have been in touch with both Georgie as well as Ramdas, of course, and we continued our association. Ramdas used to visit me on several occasions as an examiner to Andhra Pradesh when I was in Hyderabad for both Gandhi Medical College and Usmania, and also when I was in Vizag. So that association we continued. As all of you have said, he's a very astute clinician, a wonderful clinician, which we rarely come across with such people. It's not only his clinical expertise, he was a great administrator also. I went to several times to Trivandrum, I went to his place. It's very emotional to know that Jayasri is also sitting in this group and listening to what we are saying. And I met her in her house. So all through, Ramdas' character is totally different. His affection towards me as well as towards all the friends is exceptionally good. Though he used to come to Andhra Pradesh several times, he came as not only as an examiner, but also he visited our place, both here and in Hyderabad, as an MCI inspector also. So like that, till the end we continued. I knew that he was not well and suffering from some illness, but I never thought he would pass away so early. Though he is no longer with us, his legacy continues, as all of you are saying. And his legacy continued. Satish was saying that several of the youngsters may not know him, but it's a surprise for me. A lot of DM students are coming from Kerala to study in Vizag as well as Hyderabad. When I was inquiring them about Ramdas, everyone knew Ramdas. They were all mentioning very highly about Ramdas, his administrative capabilities, the way he developed Trivandrum Medical College, the way he started the super specialty block in Trivandrum. All these things they were mentioning. Not only that, he was the founder of that the cadaver transplant program in Kerala. All these things that people knew, though it was nearly more than 10 to 15 years ago that he left service and then we went to private practice, and he passed away 9 years ago. But such people you rarely come across, and I always remember Ramdas with great respect, gratitude, and affection. It's difficult to believe that he left us, but I feel he continues to live with us in our hearts. Thank you, Georgie, for giving me this wonderful opportunity to remember and also share our thoughts in the group.
Thank you.
Thank
Thank
you
you,
very much.
Professor Reviraju, very much. We'll move on to Professor Edwin Fernando from Chennai. And
Yes.
Professor Edwin, please.
Yes, sir. Thank you for giving me this opportunity to speak about sir. My association with him started when he used to come to MMC for exams. And it was once that I picked him up from the airport, and I found the interaction very, very useful, that I offered to drop him back at the airport. And it happened a couple of times. And once when I was a young assistant professor, I had presented a paper on UTI in renal transplant. So he was a chairperson. And then he told me on stage, this is not the way it should be analyzed. And then he stopped me there. So then I met him during lunch and asked him. So he explained to me very clearly how this analysis should be done, what are the factors that you must take into account. And the entire methodology of what I had done is actually wrong. So, but he explained to me in a very patient way and said, this is the way it should be done. And this is how statistics works. So then only I knew that he was a master in stats. The other quality that I used to love with him is when he speaks in a conference or meeting, the clarity with which he used to speak. So there's no doubt he was clarity personified. And I was just thinking that in this modern era, if he had been there with genetics and all the other developments that have happened, he would have been crystal clear. I definitely feel that all of us are really benefited and been lucky to known him and to have. I may not know him as well as you or Satish, but the connection was there. He was very affectionate. He used to talk to me in conferences. Unfortunately, those were the days when all these recordings and all these are not available. So the younger generation definitely missed the interaction the impact that he had. So these recordings are not there. It was not there. It was not a proper documentation process that happened. Now we can record this meeting. We can record so many things. But all this was not, YouTube was not there. So I feel the younger generation missed, and they should know about this legend. So thank you, sir, for giving me this opportunity.
Thank you, Professor Edwin Fernando, for sharing your experience or your thing about Dr. Professor Ramdas Pisharody. Now we'll go on to Professor Srilada. Professor Srilada is from Kannur now. She had a lot of years of sharing or working together with Professor Ramdas Pisharody. Let us hear from Professor Srilada.
Thank you, Georgina and sir, for the opportunity. My association with Pisharody sir dates back to my MBBS days. After completing DM from PGI, sir joined as lecturer in general medicine at Government Medical College, Trichy. And he used to take bedside clinics for third year, fourth year MBBS students. So that with a particular poster of one knee on the bed, he takes the classes, and we used to look at with great admiration. And one day I was informed that he's a nephrologist, and that made me think that only a nephrologist can handle the medicine with such depth and brilliance. So that was the first point when the thought of nephrology was seeded in my mind. And later, he was my DM examiner, and he was transferred to Calicut in 1998 or so. And I had the opportunity to work with him as his assistant professor till 2005, when he was transferred back to Trivandrum as the professor principal. And during this period of assistant professorship, I first attended my international meeting, WCN at Berlin. And I was fortunate to get the first prestigious Tanker Award and a few Best Paper Awards under his guidance during this period. That was one of the best period of my career. And more than that, academic mentor sir was a strong pillar of support during some of the very difficult phases of my life. And because of him only, I could tide over the crisis during that period. And for both academic as well as for personal challenges, he used to be my close associate. So the entire community, nephrology community, deeply misses him now. and his legacy will live in us ever. So that is my association with Professor Pisharody, sir.
Thank you, Professor Srilada, very much. And may I request Dr. Professor Jacob George from Trivandrum? Jacob also worked at the same time Medical College while he was principal. Jacob was HOD and he had a good interaction with Pisharody. Jacob, please.
I had the good fortune of being with Dr. Pisharody sir right after I completed my DA from Vellore in 1994. Since when I was in Trivandrum Medical College, I had a strong association with him. I would like to highlight one of this very amazing ability. That is, he had a singularly great talent in remembering patients' names and their faces years later. So let's just say in 1995, he has seen a patient. Even after he was transferred to Calicut, and when he came back, he would see the patient 10 years later. He would still call the patient by his name, and he would remember the diagnosis. So very, very amazing. I've worked with so many people, I have not seen this ability, which patients who we see probably after 1 year or something, we won't remember the name, but he had this fantastic ability to remember the names. That is why patients also look up to him with great affection. And that's one thing I would like to add. Thank you.
Thank you, Jacob, very much. And today I had a surprise call from Professor Saguja. I was quite impressed by his interest in attending today's meeting and to share his views or something he wants to say about Professor Ramdas Pisharody. Revraju, myself and Ramdas, we were all together for 2 years at PGI. Professor Saguja was at that time the main pillar of the nephrology department at that time. So may I request Professor Saguja, we are deeply happy, we are very, very happy, deeply moved by your interest in coming for this meeting. Professor Saguja, please. You're muted.
Yes. Thank you very much, Dr. Georgie, for including me in this evening's program. I was the moment I saw the message on my telephone, I decided that I must speak to you and find out the details about this meeting, and because I wanted to be a part of it. As you've already heard from the others, Dr. Ramdas did his MD in medicine from PGI. That is the first time we met him. And subsequently, he became our DM student and completed his DM in nephrology from PGI itself, while I was one of his teachers during that period. Of course, this was the time when Professor Chug was the head of department. So I knew him from that time onwards. So that is a very long time since now, when we first came to know him. After he completed his DM and came back to Kerala, one of the fond memories that I have is that I wanted to visit Kerala as a tourist along with my wife. And this was probably something like maybe more than 15 years ago, maybe 20 years ago. And so I then talked to both Dr. Kasi and Dr. Ramdas. And they were the two who made all the arrangements for our local stay and our travel program all over Kerala. So we have very fond memories of that visit. And during that visit, we also enjoyed his hospitality at his home, where we were also able to meet his wife. And that is something that both me and my wife remember very well. And cherish a lot. Subsequently, since Dr. Ramdas had acquired a great reputation as a clinician and as an academician, we invited him to the PGI as a DM nephrology examiner on several occasions. And he did an excellent job on each of those occasions. Subsequently, he also came as a DNB examiner, both to PGI, and I was also a co-examiner along with him for DNB examinations elsewhere. And it was in 2014, if I remember correctly, that I was a co-examiner with him for DNB at the Army Hospital, R&R Hospital in Delhi. And that was the time when he was a little unwell. He was walking with a little difficulty and he used to walk slowly. But nevertheless, we never realized at that time that that is going to be the last time that I would meet him. Because soon after that, unfortunately, we lost him forever. But I have never forgotten him. I can never forget him. And his legacy will live on in our hearts forever. I'm sure of that. Thank you very much once again for the opportunity.
Thank you, Professor Sabuja. It is indeed very great of you to have come for this meeting, and we value it very much. Thank you. Dr. Kashi, Professor Kashi Vishweshwaran, would you like to say a few words about Ramdas? Kashi?
Yeah. I have heard about Ramdas when I was working in Kottayam and he was a medical student in Trivandrum. I heard about him as a very intelligent person. I met him for the first time when I was a DM student in Chandigarh and he was already doing MD medicine. During that time, I remember a casual conversation with him. He was in the final year about to go for the MD examination. And I know that Professor Chugh was very happy with his performance as an MD student and he would have liked to have him in the department. I just casually asked him, Ramdas, what is your plan? Or specialization? He mentioned that I may think of cardiology. Then I told him that if you come back to Kerala, you will be one among the 40 cardiologists. But if you come back to Kerala with nephrology, you will be one among the 5 or 10 nephrologists in the state. So please come to nephrology. Of course, that may not have influenced him. Anyway, he has made a real mark. And he's been a real legend in the field of nephrology and also in the community. He's done a lot of work on community nephrology also. We miss him a lot. He has been a wonderful teacher, a great colleague. And when, after about 18 years in Kottayam, when I mentioned to him that I would like to come to Trivandrum and settle in Trivandrum and work in Trivandrum for 3 years, I'm going to apply for a transfer. He didn't object. He said, yes, you are justified. You please apply. And if the government gives that transfer, I have to go back. I'll go back to Calicut for a few years. That is the genuine openness that he showed. I always remember him as a good friend, as a colleague, and it's nice that Georgie have arranged a meeting for honoring him. He is a legend, there is no doubt about it, and his fond memories will remain with us forever. Thank you very much.
Ladies and gentlemen, we had a very, very active session remembering a luminary, late Professor Ramdas Pisharody, who worked with us many years in the field of nephrology. And let me thank Jayasree and daughters for coming and gracing this occasion. Dr. Sadish Balan, Professor Noble Gracious, Professor Ravi Raju, Professor Edwin Fernando, Professor Srilada, Professor Jacob George, Professor Vinay Sabuja sir, and Dr. Professor Kashi for remembering Ramdas Pisharody on his 9th death anniversary. And he is truly a legend, very intelligent, the most intelligent, one of the most intelligent person nephrology has seen. And we all remember him very fondly. He continues to live in us and we miss him.